All right, today we're going to tackle one of the most common chronic kidney diseases in kids, steroid sensitive nephrotic syndrome. If this is something your family is going through, then this explainer is absolutely for you. We are going to translate all that complex medical jargon into a clear, step-by-step guide. Okay, let's get right into it. So let's just start with the big question, right? What exactly is one of the most common chronic kidney diseases that kids face? Well, the answer is nephrotic syndrome. And really, understanding what it is, that's the first huge step to managing it well. So what's the deal with nephrotic syndrome? The easiest way to think about it is that your kidneys have these amazing superfine filters. But with this condition, those filters get, well, a little too leaky. And that leakiness causes a domino effect that gives us our three classic signs. First, you've got edema. That's the puffiness or swelling you might see, especially around the eyes. Then there's heavy proteinuria. That's just a fancy way of saying a lot of protein is escaping through those leaky filters into the urine. And number 3, hypoalbuminemia, is the direct result of that leak. The level of a really important protein called albumin in the blood drops way down. See how they're all connected? So here's our game plan for today. We're going to walk through this whole journey pretty much exactly how a family might experience it. We'll start with those very first signs, then tackle the first hurdle of initial treatment. After that, we dive into the real challenge, dealing with relapses. We'll look at the advanced therapies, the doctor's toolkit, if you will, and then we'll zoom out to the big picture, all the supportive care and the long-term outlook. Okay, let's start at the very beginning. Chapter 1, recognizing there's a problem. This is all about what happens when a child first starts showing symptoms and you know something just isn't right. So how do doctors lock in the diagnosis? Well, they use a few really key tests. It almost always starts with a simple urinalysis. Yep, a urine test, to see if that protein is leaking out. Then they'll do blood tests to check on a few things. Kidney function, of course, but also to confirm those low albumin levels. Funnily enough, cholesterol is often really high, and that's another big clue. And finally, they'll get all the basics, height, weight, and blood pressure, to get a complete picture of where the child's health is at right from the get-go. All right. Once that diagnosis is confirmed, it's time to face the first hurdle, starting treatment. And I have to say, the news here is actually really, really good. For most kids, this first step is a huge success. And this is why the news is so good. A whopping 85 to 90% of kids respond to the initial treatment. This is exactly why it's called steroid sensitive nephrotic syndrome. It's because for the vast, vast majority, the steroids just plain work. So what's this miracle treatment look like? Well, the guidelines lay out a super clear 12-week plan using a steroid called prednisolone. It's a two-phase mission. For the first 6 weeks, it's a daily dose to really knock that protein leak on the head and get things back to normal. Then, for the next 6 weeks, they switch to taking it every other day. This keeps things stable while starting to ease off the medicine. And after those 12 weeks are up, the therapy stops.
But here's the thing, that initial win is awesome, but it's often just the beginning of the story. For a lot of families, the next chapter is about facing the true, long-term challenge of this illness, managing relapses.
You know, finishing that 12-week course can feel like you've crossed the finish line. And for some kids, you have. But for many, many others, this is not the end of the story. The journey is just getting started. In fact, about half, around 50% of the kids who respond so well at first will eventually have a relapse. And this right here, this is the core challenge that these guidelines are really designed to help everyone navigate. And that challenge usually takes one of two forms, either having frequent relapses or becoming dependent on the steroids to stay healthy. So the whole long-term goal shifts. It becomes about keeping the child well without all the potential side effects that can come from being on too many steroids for too long. So what do doctors actually mean when they use these terms? Well, the guidelines are super specific, which is really helpful. Frequent relapses has a clear definition. It's either 2 or more relapses in those first 6 months, or 4 or more relapses in any 12-month stretch. And steroid dependence is when relapses happen one after the other, either while the child is still tapering off the steroids or within 2 weeks of stopping. These definitions are the triggers that tell doctors, okay, time for a new game plan. And that brings us to the next part of our journey. Opening up the doctor's toolkit. When those relapses start happening a lot, the goal changes. Now it's about using other medications to keep things stable, medications we often call steroid-sparing agents. Think of this toolkit like a ladder of options. If just using low-dose steroids long-term isn't cutting it, doctors move up to these other agents. Levmisole is often one of the first things they'll try for frequent relapses. Another really strong option is mycophenolate, or MMF, which can be great for steroid dependence and is usually taken for about 1 to 2 years. And then for tougher cases, or if a child is having a lot of side effects from steroids, they might use cyclophosphamide. It works well, but they're very careful with it, limiting it to a single 12-week course because of potential risks down the road. And for those really, really stubborn cases, what the experts call difficult to treat nephrotic syndrome, there's another level of heavy hitters in the toolkit. This is where powerful drugs like calcineurin inhibitors, or CNIs, come in. And there's also a biologic medicine called rituximab. These are absolutely reserved for those situations where the other tools just haven't been able to get the job done. Now let's zoom out. Because managing this condition is about so much more than just which medicine to use for a relapse. We gotta look at the big picture, all the day-to-day supportive care that is just so important for keeping a child healthy and happy. A huge concern for parents, and understandably so, is that swelling, the edema. Especially when it gets severe, it can be really distressing to see. So how do doctors handle that safely? Okay, this is super important. Managing swelling is not a one-size-fits-all problem. Doctors have to follow one of two totally different paths. First, they have to figure out if the child has low blood volume, even though they look swollen. They might feel dizzy or have cold hands. If that's the case, the treatment is actually IV fluids to bring their volume back up, and, this is key, diuretics or water pills are stopped. Giving them then would be dangerous. Now, on the other hand, if their blood volume is normal or even high, then it's safe to carefully use diuretics to help the kidneys flush out all that extra fluid, and of course, cut way back on salt. Getting this decision right is absolutely critical.
Let's talk about building a fortress. Because both the disease itself and the steroid treatments can weaken the immune system, kids with nephrotic syndrome are at a higher risk for infections. So the guidelines are really clear. You have to be proactive with vaccinations. This means getting the pneumococcal vaccine to protect against some nasty bacterial infections, 2 doses of the varicella vaccine to prevent a bad case of chickenpox, and an annual flu shot, not just for the child, but for the whole family. It's all about creating that protective bubble.
So after all of this, what does the future hold? I have some truly fantastic news here. For kids with the steroid-sensitive type, the risk of their kidneys failing long-term is incredibly low, like less than 1%. The kidneys themselves are usually fine in the long run. The real focus of long-term care is actually just being proactive and keeping an eye out for potential side effects from the treatments over the years, things like effects on growth, weight, blood pressure, or bone health. So when you boil it all down, what these guidelines give everyone is a smart, structured, step-by-step game plan. The goal isn't just to react to flare-ups anymore. It's about proactively managing a tough chronic illness in a way that protects a child's health today and, just as importantly, minimizes any risks for their future. And that really brings us to the final and I think most important question. We know there's a clear, effective plan to manage the medical side of things. So the real question for all of us, doctors, parents, everyone, is this. With that plan in our hands, how do we best empower these kids to not just live with their diagnosis, but to absolutely thrive beyond it? Thanks for joining me today.